Hello, I'm Susan Moore at North Colorado Medical Center today, meeting the doctors, and with great pleasure, I'd like to introduce you to Dr. Lyndsay Deeter, who's on call. And so if you get called out of this little chat we're going to have, we totally understand.
Thank you.
But your specialty is burn, and a lot of people might not know how fabulous this facility is for burn patients. Can you tell us about that?
It's a burn center that was started originally in the 1980s and was termed the Western States Burn Center. It is a center that covers approximately 9 states, so we have a very large referral area. We cover parts of Kansas, parts of Nebraska, North Dakota, South Dakota, Minnesota, Colorado, Wyoming, Idaho, and parts of Montana.
So, Dr. Deeter, you're a burn surgeon. Can you explain to us what that is?
So a burn surgeon is someone who specializes in the field of burns and usually in critical care or ICU management of patients. Burn surgeons are a little unique in that there aren't a ton of us around. Burn centers are fairly scattered throughout the country. But they're more unique in that our patients are going to require multiple surgeries for the same injury to either prime that area that was burned and enable that to heal so that we're able to put their own skin on there. We take care of patients who have anywhere from first-degree burns, which are basically similar to a sunburn, no blistering. Those typically don't require admission or surgery. Those are all going to heal on their own, all the way to burns that penetrate down to the level of bone and muscle and tendon, which are 4th, 5th, and 6th-degree burns. And so their procedures and their surgeries to heal these patients can be fairly extensive.
I would imagine that these patients come in via helicopter, on a meta helicopter.
Yes.
And it's got to be a most stressful of the medical practice.
It can be very busy. There's usually we don't have a lot of dull moments around here, but we get the opportunity to do a lot of good for people, which is truly amazing, and you get to see some great outcomes for people, which is very exciting.
Oh, how nice. We've had all these fires in Colorado. That doesn't necessarily mean you're busy, or the firefighters are probably pretty smart about that.
Usually they're pretty safe. They're always smart, but those fires can be pretty unpredictable.
Right.
And so at times we do end up with firefighters coming in to be treated as well.
Well, what about just people that are grilling in the backyard, or the new thing now is to have that fire pit on the deck?
Yes.
Do you see any of those people?
We see a lot of those people, especially this time of year. The weather's out, people want to be grilling, they want to be outside. So fire safety in those situations, especially this time of year, becomes very important for people. Making sure that you don't put any accelerants on your campfires, on your fire pit fires, in your grill, and making sure that you're also watching the little ones around those fires is very important.
Would they end up at the emergency room and then come to see you?
The vast majority of our patients are seen at outside facilities, and then we have a transfer center for which they field all of our phone calls. And whoever is on call for our team receives that phone call, and then we're able to assess whether or not they are somebody who needs to be admitted and transported to us immediately, or if they sound like they're an appropriate patient for follow-up in our clinic within the next couple of days.
Okay. Do you have any patients on your mind right now? I know we can't
Yes.
know their names or anything, but is there anybody right now that you'd like to tell us about? A happy ending?
We've had a great deal of success since I've been here. I've only been working at this burn center here for about the past 7 months, and I've been very fortunate to join just a great team. They welcome me with open arms and have just been wonderful to work with, and I feel very fortunate to be here. Our nursing staff is wonderful and takes great care of everybody. We are able to use our burn specialized therapists, as well as nutritionists, and our psychological support team as well, because burns are a pretty all-encompassing injury. It's more so than just a broken arm, and it takes a lot longer to heal the skin, as well as kind of the stress and the trauma that goes along with these situations. So we've had some good successes, and some patients out there who are really making a lot of progress, and it's great to see and be a part of that.
I would think that would be one of the most painful injuries, is to have a burn.
Yes, it's a very, very painful injury for patients, and we end up doing a lot of different multimodality type of treatments in an attempt to take care of that pain, whether that be
Back up. Modality.
different types of things to help with that. We can use narcotics and pain medications, different kinds of medications, not just narcotics. But we'll also use our therapists to help with that, positioning, splinting, stretching, therapy, exercises, early mobility. All of these things will contribute to trying to make our patients more comfortable.
Where did you go to school?
I went to medical school at Creighton University in Omaha, Nebraska.
And why did you choose that school?
I had gone to undergrad there, and it was honestly just a great fit for me. It's a private Catholic school, Jesuit school. I'm not Catholic, but it was just a wonderful fit for me as far as being able to focus. They really focused on outreach and humanitarian work, and that was something that really appealed to me.
Did you always know you wanted to be a doctor?
Well, when I was really little, I thought that I was going to be a Dallas Cowboys cheerleader, and followed by being president of the United States, which naturally follows being the Dallas Cowboys cheerleader. Oh. However, not long after that, I kind of made the switch, and originally had wanted to work in pediatrics when I was younger. And then as I got older, I played sports through high school and college, and got to know some orthopedic surgeons, and thought, the surgery thing is really, that's for me.
Is that right? Mm-hmm. Oh, nice. Well, you did way more important things than cheerleader or be the president. Tell me what you do in your spare time. That's spare time.
Well, since we've recently moved here, we have loved exploring the area. My husband and I love taking our dogs out hiking and biking and sailing and skiing and snowboarding, and so we've just really have truly enjoyed the area and just feel very fortunate to be here. It's a great place.
All right. Is there anything I haven't asked you about as far as your job, you're taking care of burn patients, that you'd like to add?
I think one of the most important things for us to remember as our burn team takes care of people and our patients is that it truly is a multidisciplinary team. It's one of the few specialties where we truly have a team devoted to these patients that encompasses, like I'd mentioned before, nutrition, therapy, the psychological aspect, the medical aspect, the reintegration into their home life, because it's such an all-encompassing injury for patients and for their families as well. And so I love that. I love that it's basically a team sport, that I get to come to work every day and learn something new from everybody that I work with, and that we can really brainstorm to try to come up with the best way to treat people and have better outcomes. So.
Nice. Yeah. So if somebody does get a burn, doctor, what steps do we take before we call you? Is there something we can do to maybe ease the pain before we actually get to see the doctor?
Yeah, the most important thing to remember is if you have a fire, stop, drop, and roll.
Okay. Most important thing.
It's very simple, and it goes back to what everybody learned in kindergarten when the firefighters came out to visit us, or we went to go visit them at the fire department. But the oxygen is actually going to fuel the fire, and so by stopping, dropping, and rolling, you're able to put that fire out. At that point, then you need to go ahead and cool the area. You don't want to put ice on the injured area. That's going to cause more complications, but you want to run some tepid water over the area that's been injured to go ahead and try to stop the burning process. For any chemicals that have been on it, we want to irrigate it very, very copiously to try to rid your skin of that chemical and stop the furthering of that injury.
Okay.
So after that, you're going to go ahead and want to proceed to your nearest emergency room or primary care physician to be evaluated, and they'll be able to determine whether or not you need to be referred to a burn center.
All right. Well, Dr. Lyndsay Deeter on call, thank you for taking time to chat with us and tell us about, telling us about what you do. We appreciate that. I'm Susan Moore at North Colorado Medical Center with Banner Health and Spirit of Women.